Hello everyone, and a very warm welcome to my channel. My name is Mona, and on my channel I talk to you about autism from the perspective of families and parents. I am a parent to a beautiful autistic child myself and just recently finished my master's in autism studies. So through my parental experience of around 13 years, as well as my education in autism, I hope to provide information that is valuable to parents and the community out there. In this video in particular, I am going to share information that families that have just recently received a diagnosis of autism of their child may find helpful. So without any further ado, let's dive in. The first thing that I would like to talk about in the post-diagnosis phase is the validation of feelings and reactions that parents may be having. Now, each family's experience and response is going to be very unique based on their circumstances, their cultural background, as well as their individual perspectives. And it is really important that all these feelings at this crucial time are validated and respected. So, some common feelings that parents usually go through are shock or disappointment, sadness. They may feel guilt and may self-blame, and it is really important that families are given that time to process those feelings so that they can adjust and accept the diagnosis and move on. The second thing that I'm going to touch upon is the choice of supports and therapies for the child. Now, many parents are quite eager after the diagnosis to start with any therapy that is going to help their child manage their difficulties in their daily life. It is important that parents at this time don't go overboard and they realize the importance of two things. Number one, that they need to make a choice for a support that is evidence-based. And number two, they need to work in collaboration with the professionals. So I'm going to briefly touch upon these 2 points. An evidence-based practice basically means, in terms of with reference to autism, basically means any practice, any supports that has undergone a rigorous research process and has been found to benefit the individual with autism. And the other thing, and the second point, is that parents don't take decisions about choice of therapies themselves. In fact, they work in collaboration. They need to share with the professional the immediate needs of their child, any immediate concerns that they have about their child, and also most of their concerns would be a reflection of their values and the context that they are in. So keeping all this in view, making sure that whatever is being chosen is of benefit to the child, him or herself, is going to reap long-term benefits for the child as well as the family. So it's really important that families know the concept of an evidence-based practice, as well as they are willing to work in collaboration with the professionals. The third thing that I find is really important for both the professionals and the families to know is that every family is going to understand and experience autism in their own unique way. We all know that a family is a distinct social group in itself. So they are influenced by their context, by their culture, their religion, and all that is going to come into play in their understanding of the autism diagnosis of their child. Individual perspective is going to impact how much the families become involved in their child's raising and how comfortable they are with advocating for their child, as well as in collaboration with the community, that is the teachers, the healthcare professionals, to support their child. So when a professional comes across any family, they also need to keep into perspective the cultural needs of that family. So parents, along with the diagnosis of autism, your child may be having some other conditions coexisting with an autism diagnosis. You may feel that your child is a poor sleeper, may have some gastrointestinal issues, or they may be they may be showing a lot of challenging behaviors because of the anxiety that they may have. So it is important that you talk to the professionals regarding your concerns that you see in your child at home. This can be done at the time of the diagnosis, or it is something that you think that you continue to observe in your child even after the diagnosis, it is important that you get in touch with the professionals and talk about your concerns. A lot of times, many other co-occurring conditions like anxiety, sleep disorders, like gastrointestinal issues have been commonly found in individuals with autism. Another thing that families may struggle after the diagnosis is the big question that how they are going to share this information, the news of their child's diagnosis, autism diagnosis, with the rest of the family. Now, it is important to consider that different members of the family may react in a different way. However, I think that having an open and honest communication with the family and friends is really important when you're talking about the disclosure of your child's diagnosis, and encouraging your family to educate themselves about autism and involving them in this journey can foster a lot of understanding and support that you may be lacking if you decide not to go for the disclosure. But again, it is something so individual and so unique to each family that I would leave it to every family's unique perspective on the disclosure. The highlight of what can help families after the diagnosis is that families themselves gain education on autism and educate themselves about autism characteristics, about the communication strategies, about sensory issues that are commonly found in autism. Many workshops, webinars, and training sessions held for parents to get a deeper understanding of their child. And the idea behind these sessions is to empower the families with knowledge that is going to help them in the post-diagnosis phase. Home-based intervention and therapies is another option that families can look into. And for example, personally in my child's case, I opted for a home-based intervention program because I felt that in the environs of the home he was able to focus more and also get a lot more of the daily living skills that we were able to practice with him while at home. But again, it can be a mixture of both, your child getting supports at home as well as at school or out in the community. This is something that you can discuss with your clinician. Another thing that I would like parents to know after the diagnosis of their child is that they can search for accommodations for their child out there in the community. So I'm going to give a specific reference here to the school, so they can get in touch with the school, share the diagnosis, and ask the school as to what kind of adjustments the school can provide to the child as regards to his or her academic studies, as well as their social skills and their physical and mental health. So it is highly recommended that schools play their role in supporting your child. So, understanding your child's rights and advocating for appropriate accommodations for your child out there in the community is essential for their success. Now, parents of autistic children face numerous challenges, and one of them is the financial strain. It has been seen in many families that one of the parents would choose to give up their career and in order to provide more time and care to the autistic child. So that means putting a strain on the financial aspects of the family. So in this case, and also I know that sometimes families have to pay out of pocket for the services and therapies that they are providing to their child. And sometimes families have to relocate or change their careers in order to cover the cost of these services. So keeping these financial constraints under consideration, it is recommended that families also take advice from a financial expert to see how they can manage their finances in the long run. Lastly, I would highly recommend that parents put their own self-care on priority. Unless and until their own mental and physical health is not at the optimal level, we as parents would not be able to provide the care and support that our family needs. So parents should not feel ashamed when seeking respite from parental duties, and I feel that seeking respite, is not a sign of weakness. Rather, it's a necessary and healthy practice that benefits both the parents and the family the autistic child and your other children in general. So with this, I end my video. I hope I was able to cover some important information that parents whose children have recently been diagnosed with autism can find helpful. If you know of any other suggestions, please let me know in the comment section. And if you like the video, please do give it a thumbs up. I will now see you in the next video. Till then, take care and goodbye.